Hello friends, welcome to the crisis and its management during COVID-19 presented by me, Dr. Maithili Hazarika, an associate professor of clinical psychology from the Department of Psychiatry, Guwahati Medical College and Hospital. I am involved in different organizations from the state. The disclaimer is the discussions generated during the presentation are academic in nature. They are not the laws, nor are they substitutes for professional legal opinion. For any kind of legal opinion, please contact an advocate or a lawyer. What is crisis? It is a perception or experiencing of an event or situation as an intolerable difficulty that exceeds the person's current resources and coping mechanism. So, when there's a crisis, there is a significant impact on our health. James also speaks that till a person receives relief, the crisis has the potential to result in severe affective behavior and cognitive malfunctioning. That is, we may disintegrate in our emotions, in our behavior, the thought process may totally get disoriented. So the causes of crisis are intensely stressful, traumatic, or hazardous event like COVID-19 pandemic, an individual's perception of the event as the cause of considerable upset or disruption, that how we view the event also determines how stressful we would be. An individual's inability to resolve the disruption by previously used coping mechanisms. If we had certain coping mechanisms and that is not actually helping, then it might lead to disruption. What are the principles and characteristics of crisis? Crisis embodies both danger and opportunity for the people experiencing it. It is time limited but may develop into a series of recurring trans-crisis points. It is complex and difficult to resolve. The life experiences of crisis enhance the worker's effectiveness in crisis intervention. Crisis also contains the seeds of growth and impetus for change. It doesn't have a quick fix solution. It confronts people with different kind of choices that we have to make. Emotional disequilibrium and disorganization may accompany crisis. The COVID-19 is a crisis situation. So in these kind of situations, people normally break down if it is very, very stressful for them and they have no coping resources. But certain in ideal circumstances, some individuals are able to cope on their own and emerge stronger as a result of their own experiences, and they are more resilient. So we need to build up our resilience. Others appear to survive the crisis, but effectively block the pain from their awareness, resulting in ongoing impacts of the crisis situation. Others appear to become immobilized at the time of crisis and become incapable of moving on with their lives unless provided with immediate and intensive intervention. Crisis intervention has certain steps. First is assessing, passively as well as actively. If threatening, then action-oriented it should be. Listening, we should attend, observe, understand, respond with empathy, genuineness, respect, acceptance, non-judgmental caring. It is essential to establish an environment that provides individuals with psychological first aid, which is defined as the establishment of safety of the client to reduce the stress-related symptoms, to provide rest and physical recuperation, and linking clients to critical resources and social support systems is an essential part of the helping process. What are the different steps of crisis management? First is define the problem. The first step is to define and understand the problem from the client's point of view. You will need to use a lot of listening skills like empathy, genuineness, and acceptance. It should be client-centered and humanistic viewpoint. Should be client-centered, that is Rogerian kind of therapy approach. Ensure client safety. It is necessary that you continually keep client safety at the forefront of all interventions. This step is a very fluid one in that assessing and ensuring safety is a continuous part of the process of crisis intervention. Provide support. It is important that you communicate to the client that you care about her. The support given may be emotional as well as instrumental and informational. There are some active strategies, that is to collaborate and participate in certain ways in helping the client to mobilize the coping skills. Listening skills are always important from the very beginning of the crisis, handling of the crisis, to the later part of the crisis. We need to examine the alternatives, that is, assess the support from family and friends, whether he has friends, he has family or not, helping the client identify the coping mechanisms that he already has, the behavior which is not so appropriate at this point of time, so give some alternatives to behave in a certain manner. Assist the client to examine the thinking patterns, that how he can reframe his thinking process, how he can think positive, that thinking that this is a very, very temporary situation. So we should not think that it is going to be like this forever. So that will lessen a lot of anxiety. Making plans, that is detailed plan to outline the person, group, and other referral resources that can be contacted for immediate support to provide the coping mechanism, certain actions, steps, in collaboration with the client, of course, because he has to feel the ownership of the plan. It should not be given to him. It should be discussed, and with a very, very collaborative approach, we need to make him sense the autonomy and control on himself. So there should be equilibrium and stability that has to be reached with a consensus decision that we had made with the client. Obtaining commitment, asking the client to verbally summarize the plan. If there is a lethality that is involved in the commitment, may be written down and signed by both the individuals, that at no circumstances we are going to do this and that, which may be little and which could be harmful for us. The goal is to enable the client to commit to the plan and to take definitive positive steps to designate and facilitate them moving towards re-establishing a pre-crisis state of equilibrium, that is how he was before the crisis had happened, to take him to that kind of a status. The commitments made by the client need to be voluntary and doable. A plan that has been developed by you, by the counselors, will not be effective if it doesn't agree to that. Objective assessment of abnormal affect, any signs of disequilibrium like depression, anxiety, stress needs to be elicited by different kind of assessment tools that I have already provided. And if a client is emotionally out of control or severely withdrawn, what kind of techniques that you have to do. You can assist the client to regain the control and mobility by making him express the feeling in a very, very appropriate and realistic manner. Behavioral observation. Observe the behavior of the client. Ask him, is he or she pacing too much? Is he having difficulty in breathing? Is she able to calm down herself or unresponsive? In crisis intervention, the quickest way to get the client to become mobile is to facilitate positive action that the client can take at once. These are the mechanisms that all the frontline health workers can take in order to deal with the crisis. This may involve asking the client to breathe slowly with you. It may mean leading the client through a grounding exercise, which I'm going to talk during my presentation later. The cognitive state is very important to elicit. What is the client's thinking pattern? What is the client talking? Is it logical? Does it make any sense? Or it cannot be understood about his feelings and behavior. Listening in crisis intervention is very important. Use open-ended questions, like it is helpful to start with what or how questions, or ask for more clarification in details. Close-ended questions seek specific concrete information, and they are designed to elicit specific behavioral data of yes or no responses. Close-ended questions usually begin with verbs such as, do you feel like this? Can you tell me who is with you? Like that. So close-ended questions are useful for obtaining commitments to take actions and request specific information. Restatement and summary clarification. By restating what the client has said in your own words, you can get clarification and agree upon the client's thought process and what he is attempting to say, feel, or think. Owning feeling. I statements are important in crisis intervention because of the directive stance you may have to take with clients who are immobilized or disequilibrium. For example, I am not sure that I clearly understand the relationship between you and your partner. Can you tell me more about what happened? Conveying understanding, the I understand statement is one that conveys to the client that you do understand that what is happening to them is causing them distress. So you have to use a lot of I. I understand what you are saying. I can empathize with you. I can reassure you. These kind of statements needs to be used. Value judgment. In danger of hurting herself or someone else, the value judgment needs to focus on the behavior, not the client. For example, I am very concerned when you talk about thinking and wanting to do something to your partner. What do you mean by that? Positive reinforcement is important. Pointing out when a client is doing well is important, and it will definitely reinforce his helpful behavior. For example, good work. You have been able to take deep breaths in order to help calm yourself. Now that you are more relaxed, you'll be able to think more clearly. Personal integrity and limit setting is important. It is important to set clear limits when clients get out of control. Example, I can see that you are very angry, but you cannot continue this way. This behavior is going to be harmful for you. If you continue, I will need to end our session and ask you to leave this conversation or leave this room. So personal integrity and limit setting with abusers, with problem callers are very, very important to set. Assertion statement. Crisis intervention often means that you will need to take control of the situation. In making requests for compliance, you will often need to be very directive and specific. For example, I want you to agree to not harm yourself and to sign this agreement. So these are certain situations you probably have to handle, not in telecommunication, but in person. Facilitative listening involves focusing completely on the client's experience. Listening involves paying attention to both the client's verbal and nonverbal messages. If you are with him face to face, you can read his nonverbal messages also. You have told me that you want to leave your relationship, but I sense some sadness about your decision. Something like that, that you can sense some sadness about leaving his or her partner. Then facilitate the conversation, facilitate the process of change with the person in distress. Facilitate responding, which enables clients to gain a clearer understanding of their feelings, inner motives, and choices. It helps clients understand the full impact of the crisis situation. This allows the clients to become more objective, and they become external observers of the crisis and to refocus in rational ways. Like, for example, it appears like you are feeling stuck. I wonder what would happen if you could take a step back and look at your situation as though you are observing someone else. What would you say to that person? Or if your best friend was here right now, what would she tell you about your situation? So something like that, so that a person comes out of his self and notices what and how he is behaving and thinking, and then tell him to say some appropriate statements to come out of that problem. That is another way of facilitating responses. So these are different methods that I have told you about in managing crisis in different ways. In telephone counseling, it is different. If you're meeting a person who is in distress, probably your own parents, your own family, friends, these are the different kind of ways and techniques that you can deal with in managing the crisis situation. Thank you.